Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. Child's Pose. For this pose, you will need at least 1 to 2 yoga blankets, possibly a block or 2. We're going to take a look at Child's Pose and its modifications. Child's Pose is restorative in nature, so you'll want to practice mastery of an abdomino-diaphragmatic breath or a belly breath here. This pose is unique in that it offers you a way to feel and expand and develop back breathing, or what I call fish gill breathing. Let's get started. From a kneeling position, add a blanket under the knees as you need it. I'll demonstrate the full pose first. The knees are wide, the toes may touch. Support yourself with the arms as you work your way down. Notice how my arms are wide here. They're not straight up by my ears, which is a rare thing for someone to be able to accomplish, particularly if you're using this for therapy and injury prevention. Also note that my arms do not wrap around by my sides for this type of therapy. They're out to the sides. That's what is called a Scaption Angle. This is the full Child's Pose. If you look at my rib cage, about mid-thigh, you can appreciate how as I inhale, you can see the back expanding and space between the ribs, or the intercostal area. Now let's take a look at how to modify it. First, we will add a thinly rolled section of blanket. In this case, I'm using my yoga rug. It's very thin, not very tall, in order to accommodate the space under the ankle as it's placed under the axis of rotation. This will also help prevent foot drop and any circulatory issues, and it certainly makes the posture more comfortable and sustainable for a longer time. Next, add a yoga couch. If you need instructions on how to fold a yoga couch, see that video, which is available in this series. You may also need a block nearby, should you decide that as you come into Child's Pose with your head resting on the top tier of yoga couch, that the pose is not supported high enough. You can turn the head to one side or the other, but just make sure you practice both sides equally, which will help you with neck rotation. Next, you can add a block to elevate the pose even further. Notice how my head has a perfect resting point on the top tier, leaving room for the chest and or the belly, which is particularly important for women who are pregnant. So this pose is adaptable and modifiable for almost any population. Also, I want to add that you can add another blanket over your heels and lower legs. Just make sure not to put it behind the knee. This is to elevate your sitting surface. Again, especially for anyone with a hip or pelvic impingement or hip pain, those with limited hip or knee range of motion, breathing difficulties, or pregnancy. You should be completely comfortable in this pose. There should be no change in sensation to the feet at all. No numbness, no tingling. If so, take that information to your therapist so they can work to assess and evaluate and determine what's happening there. For those with neck or hip pain, You can place the elbows underneath you, as I just demonstrated, to help you support the pose, so it doesn't feel like you're hanging on the neck or the spine or the hip joint. You can also place the hands under the forehead if necessary, so that you don't have to turn the head to one side or the other. Make sure there's plenty of space for the belly to expand, and really appreciate the fish gill breathing that can take place here. This pose is wonderful to promote feelings of safety, to reduce anxiety, remember, the arms don't have to be straight in this position. They can rest comfortably to the sides with the elbows bent. This also will reduce impingement and issues in the shoulder and also prevent them. Focus on feeling a back breath here, a fish gill breath, especially if you tend to chest breathe or have any history of anxiety. And if the pose is feeling exceptionally good, you can certainly give a thumbs up. Thank you for joining me.